Imagine walking into your doctor's office for a simple, routine checkup. You're not sick. You're not in pain. It's just one of those tests your doctor recommends to stay on top of things. You sit down, you follow instructions, and you leave thinking you've done the right thing for your health. But here's the shocking truth most seniors don't know: this very test, the one done every single day in clinics around the world, can secretly increase your risk of a stroke overnight. I know that sounds unbelievable. After all, aren't medical tests supposed to protect us, not put us in danger? That's what I used to believe too, until I started noticing patterns in my own patients. Perfectly stable seniors would undergo a test one morning, only to return with dizziness, weakness, or even signs of a mini-stroke just hours later. And in some cases, those minor events turned into devastating strokes that permanently changed their lives. The scariest part? Nobody warns you. It's not written on the consent forms in bold letters. It's not something most doctors even bring up. Why? Because these complications are considered rare. But when you're the one affected, it's not rare, it's life-changing. Here's the thing: as we age, our arteries stiffen, our blood flow slows, and our brains become more fragile. What might be a harmless procedure for a 30-year-old can become a hidden trigger for someone over 60. And that's why you, or your loved ones, deserve to know the full truth. In this video, I'm going to reveal exactly what this routine test is, why it raises your stroke risk, the science behind it, and most importantly, what you can do to protect yourself. Because while you may not be able to avoid medical tests forever, you can take steps to make them safer. Stay with me until the very end, because the 3 brain protection strategies I'll share could save you or someone you love from a preventable stroke. So, let's get started. Last year, one of my patients, let's call him Mr. Ahmed, came in for what was supposed to be a routine medical test. He was 68 years old, retired, and living a normal life. He wasn't sick, he wasn't in any crisis. His doctor simply suggested the test, just to be safe. He walked into the clinic smiling, joked with the nurse, and felt proud that he was taking care of his health. But less than 24 hours later, he was rushed to the emergency room with slurred speech and weakness on his right side. The diagnosis? Stroke. When his family asked me how this could have happened, they couldn't believe my answer. The very test meant to monitor his health had disturbed a fragile artery and triggered the stroke. What was supposed to be a simple checkup turned into a life-changing event overnight. And here's the part that shocked them most: it wasn't rare. I've seen this happen more times than most people would ever imagine. Seniors, especially those over 60, face a hidden danger during some common medical tests. Tests that are considered routine. Tests that doctors rarely warn patients about. Now, I don't say this to scare you for no reason. I say it because knowledge is power. When you understand how and why these risks happen, you can take control. You can ask better questions. You can protect yourself and your loved ones. In this video, I'm going to reveal the routine test that silently raises stroke risk, explain the science behind it, and show you 3 brain-protecting steps that every senior should know. If you value your independence, your memory, and your health, then stay with me until the very end, because what I'm about to share could literally save your brain. So let's dive in. Most of us think of stroke risk in terms of lifestyle choices: smoking, high blood pressure, diabetes, lack of exercise. And yes, those are critical factors. But what almost nobody talks about is that stroke risk can also hide inside the very healthcare system that's supposed to protect us. I've sat across from families, stunned and heartbroken, after a loved one suffered a stroke right after what was described as a routine test. They ask me, "Doctor, how can this happen? Isn't the test supposed to be safe?" And the truth is, while these procedures are designed to help, they sometimes carry silent risks, risks that are rarely explained, especially to seniors. The reason is simple: as we age, our blood vessels become more fragile. Plaques develop in the arteries, blood flow changes, and even small disturbances can set off a chain reaction. For a healthy 30-year-old, a diagnostic test might be nothing more than an inconvenience. But for a 70-year-old with hidden artery buildup, that same test can dislodge a clot, spike blood pressure, and trigger a stroke. That's why I felt compelled to make this video. Because while doctors perform these tests every day, very few patients are told the full story. And without that knowledge, seniors walk in unprepared. So in the next few minutes, I'm going to pull back the curtain. I'll reveal which test raises stroke risk, explain the science of how it happens, and most importantly, share how you can protect yourself before and after routine procedures. Because your brain, your memories, your independence, your very identity, is far too precious to gamble with. So, what exactly is this routine test I'm talking about? It's called a carotid artery ultrasound, sometimes paired with a carotid duplex scan, and it's one of the most common vascular tests doctors order for seniors. On the surface, it looks completely harmless. A simple ultrasound probe is placed on the side of your neck to check the blood flow through the carotid arteries, the major highways carrying blood directly to your brain. Now, before you panic, let me be clear: most of the time, this test is safe. Millions of seniors have it done every year without any problems. But here's the part nobody explains: in certain individuals, especially those over 60 with artery plaque buildup, this test can disturb fragile plaques on the artery walls. Think of your arteries like water pipes. Over the years, fatty deposits, calcium, and cholesterol form little, build-up spots on the inside. Some of these plaques are stable, they sit there without moving. Others are fragile, like a scab waiting to break loose. When an ultrasound probe presses against the neck or when the technician applies even slight pressure, those fragile plaques can rupture. Tiny fragments break off, travel upward, and block smaller arteries in the brain. And that's how a stroke can begin, in minutes. I remember one patient, a 72-year-old woman, who came for a routine carotid ultrasound because her doctor heard a faint bruit, or sound of turbulent blood flow, in her neck. The test seemed to go well. But later that evening, she developed sudden numbness on her left side. By the time she reached the ER, the scan showed a small clot blocking blood flow in her brain. The culprit? A dislodged plaque fragment. And it's not just the ultrasound. Other related vascular tests, like carotid angiography or cardiac catheterization, carry even higher risks. In these procedures, doctors insert catheters or inject contrast dye into blood vessels to get clearer images. While these tests are often necessary and even life-saving, they are invasive, and the risk of disturbing artery plaques rises significantly. Here's something even more surprising: sometimes, doctors will gently press on the carotid artery during a physical exam to feel the pulse or check blood flow. For most patients, it's harmless. But in seniors with narrowed arteries, that pressure can trigger sudden drops in blood flow, dizziness, or even a transient ischemic attack, mini-stroke. Now, you might be wondering, if this is such a risk, why don't doctors warn us more clearly? The truth is, complications are considered rare. And statistically, yes, the majority of patients walk away fine. But as a neurologist, I've seen enough cases to know this isn't just a theoretical problem. It's real, it's underreported, and it can be devastating when it happens. The real issue is that most seniors aren't given the full picture. They're told the test is routine and safe, and technically it is, until it isn't. And when you consider that stroke is already one of the leading causes of disability in seniors, even a small added risk should be taken seriously. So let's be clear, I'm not telling you to refuse every test. sometimes these procedures are essential. What I am saying is that seniors deserve to know the truth, that even routine tests can carry hidden dangers, especially when fragile arteries are involved. And the first step to protecting yourself is understanding exactly how this happens. To really understand how a simple test can trigger something as catastrophic as a stroke, let's look at what's happening inside your arteries. Your carotid arteries, one on each side of your neck, are like superhighways delivering oxygen-rich blood straight to your brain. Without them, your brain cells can't survive. But over decades, these highways get damaged. High blood pressure, high cholesterol, smoking, diabetes, and even normal aging slowly wear down the artery walls. Tiny cracks form, and your body, trying to repair them, lays down fat, calcium, and cholesterol. This becomes plaque. Now, not all plaques are created equal. Some are stable, like a thick wall of cement that doesn't move much. But others are fragile, thin, soft, and prone to rupture. And here's where the danger comes in. When a routine test like an ultrasound probe presses on your neck, or when contrast dye flows through the artery during an angiogram, that fragile plaque can rupture or break apart. When this happens, tiny fragments, called emboli, are released into the bloodstream. These fragments travel upward, and because the carotid arteries lead directly into the brain, they often lodge in small vessels that supply critical brain tissue. Blood flow stops, brain cells suffocate, and within minutes, stroke symptoms appear: weakness, slurred speech, vision changes. Another hidden factor is blood pressure surges. Most people feel a little nervous before medical tests. Anxiety raises stress hormones like adrenaline, which spike blood pressure. For fragile arteries, this sudden rise in pressure is like a gust of wind shaking an unstable tree branch. It can make the plaque break loose. And there's more. Your neck contains special pressure sensors called baroreceptors. Their job is to regulate blood pressure by adjusting heart rate and vessel dilation. But during a test, if too much pressure is applied to these sensors, it can cause sudden, dangerous drops, or spikes, in blood flow. In younger people, the body usually recovers quickly. But in seniors, who often have stiffened arteries, this imbalance can starve the brain of oxygen long enough to trigger a mini-stroke or fainting episode. Let's not forget about contrast dye, commonly used in more advanced imaging like CT angiography or catheter-based angiograms. While generally safe, this dye can sometimes make blood thicker, disturb clotting, or even strain the kidneys, which indirectly increases stroke risk. When you put all these pieces together, the picture becomes clear. A test that seems harmless can, in rare but very real cases, set off a cascade of events: plaque rupture, clot formation, blood pressure swings, oxygen starvation, and finally, stroke. I'll never forget one patient, a 74-year-old man, who came in for a vascular scan because of dizziness. During the test, the technician had to adjust the probe several times on his neck. Later that evening, he developed sudden blindness in one eye. An emergency scan revealed a clot lodged in his retinal artery, a direct result of plaque disturbed during the test. Thankfully, we caught it before a major stroke occurred, but it was a sobering reminder of how delicate the balance really is. And that's why this matters. Not because every test will cause harm, but because the risk is real enough that seniors deserve to know the truth. You deserve to walk into any medical test fully informed, fully prepared, and with strategies in place to protect your brain. Now that we understand the science, the next question is, who is most at risk? Because not every senior faces the same danger. And knowing your personal risk could be the difference between walking away fine, or walking away with a life-changing stroke. By now, you may be wondering, does this mean every senior who goes in for a carotid test or vascular scan is at risk of a stroke? The short answer is no. Not every person faces the same level of danger. but some groups are far more vulnerable than others. The first and most obvious factor is age. Once you cross 60, your arteries have usually been through decades of wear and tear. Even if you've lived a healthy life, natural aging causes blood vessels to stiffen and plaque to accumulate. That means a 70-year-old is far more likely to have fragile plaques than a 40-year-old. Next, existing vascular disease. If you've already been told you have narrowing of the carotid arteries, peripheral artery disease, or heart disease, your risk is significantly higher. These conditions often mean your arteries are loaded with unstable plaques that can be disturbed by pressure or catheter-based procedures. A history of stroke or mini-stroke, TI, is another major red flag. If it's happened once, it means your arteries have already shown they're vulnerable. A routine test can be the trigger that sets off another event. Then we have the big three lifestyle-related risk factors. High blood pressure. Constant pressure damages the artery lining. Diabetes. Sugar weakens blood vessels and promotes plaque buildup. Smoking. Toxins inflame and scar the arteries, making plaques even more unstable. Add in high cholesterol, particularly elevated LDL, and you've created a perfect storm inside your arteries. The plaques that form under these conditions are softer, thinner, and far more likely to rupture. And finally, kidney disease plays a silent but important role. Seniors with weak kidneys often react poorly to contrast dyes used in vascular imaging. This can thicken blood, affect circulation, and raise clot risk. So, while not everyone is equally vulnerable, the reality is that millions of seniors around the world fall into one, or several, of these categories. And for them, what seems like a routine test can carry far more weight than anyone tells them. But here's the empowering part: once you know your risk, you can take specific steps to protect yourself. And that's exactly what we'll cover next: how to prepare before a test, how to stay safe during, and what to do afterward to shield your brain. Now that you know the risks, let's shift to what truly matters: protection. Because the goal here isn't to avoid every test, that would be impossible, and in many cases dangerous. The goal is to walk into any procedure prepared, with your brain and arteries shielded as much as possible. Over the years, I've developed a checklist for my own patients. These are steps that dramatically lower the odds of a routine test turning into a medical crisis. And today, I want to share them with you. 1. Ask questions before the test. Never, ever walk into a medical test blindly. When your doctor recommends a carotid ultrasound, an angiogram, or any vascular test, ask: why is this test necessary? Is there a safer alternative, like an MRI or CT scan? What are the risks for someone my age and condition? Most doctors will be happy to explain, and if they hesitate, that's a red flag. Remember, you're not being difficult. You're being smart. 2. Optimize your health ahead of time. Your body is like an army, it fights better when prepared. In the weeks before a scheduled test, make sure your blood pressure, cholesterol, and blood sugar are under control. Even a few days of eating clean, leafy greens, whole grains, fish, and less salt can stabilize plaque and reduce inflammation. If you take prescribed medications, don't skip doses. Stability is your best defense. 3. Stay hydrated and rested. This might sound simple, but it's powerful. Dehydration thickens the blood, making clots more likely. Sleep deprivation raises stress hormones, which spike blood pressure. Drink plenty of water the day before, get a full night's rest, and arrive calm. Your arteries will thank you. 4. Discuss your medications. If you're on blood thinners, statins, or heart medications, ask your doctor whether you should continue them before the test. In many cases, keeping these medications consistent lowers risk. But in some situations, adjustments are needed. The key is not guessing, Always clarify. 5. Monitor closely after the test. Here's where many people drop the ball. They go home, feel a little tired, and dismiss symptoms. Don't make that mistake. For 24 to 48 hours after a vascular test, pay attention to your body. If you notice sudden weakness, slurred speech, dizziness, vision changes, or confusion, seek emergency help immediately. Time is brain, every minute counts in stroke care. 6. Strengthen your lifestyle shield. Tests may come and go, but the foundation of protection is daily habits. Diet: load up on leafy greens, berries, nuts, and omega-3 rich fish. These reduce inflammation and keep plaques stable. Exercise: even 30 minutes of walking improves circulation and brain oxygenation. Quit smoking: nothing destabilizes plaques faster than cigarette toxins. Manage stress: deep breathing, prayer, meditation, or light yoga calm your nervous system and prevent dangerous blood pressure spikes. 7. Advocate for yourself. Finally, don't be afraid to speak up during the test. If you feel dizzy, lightheaded, or uncomfortable while a probe is on your neck, say something immediately. A skilled technician will adjust. You have every right to protect your brain. I often tell my patients, the test itself doesn't protect you, your preparation does. When you walk in informed, hydrated, stabilized, and alert, you dramatically reduce the chance of complications. And here's the hopeful truth: most seniors who follow these steps go through their tests safely, get the information they need, and walk out stronger. You don't have to live in fear, you just have to live prepared. Here's the bottom line: no medical test is ever 100% risk-free. Even something as routine as a carotid ultrasound, angiogram, or vascular scan can, in the wrong conditions, trigger a stroke. And yet, these same tests are often necessary. They can detect blockages, prevent bigger problems, and even save lives. So what should you do? The answer isn't to live in fear or avoid every procedure. The answer is to go in with your eyes wide open. Understand the risks. Ask the right questions. Prepare your body. And monitor yourself afterward. When you do that, you transform from a passive patient into an active protector of your own brain health. Think of it this way: crossing a busy street is risky too. But you don't stop crossing streets, you look both ways, wait for the light, and stay alert. That's exactly how you should approach medical testing. With awareness, preparation, and caution, you greatly reduce the danger while still getting the benefits. As a brain doctor, I've seen too many seniors blindsided by complications they were never warned about. My mission is simple: to make sure you are never one of them. Because your brain, your memories, your independence, your very identity, is priceless. It deserves every ounce of protection you can give it. So the next time your doctor schedules a routine test, don't just say yes blindly. Ask, prepare, protect. That way, the test truly serves you, without putting your future at risk. Stay strong, stay informed, and most importantly, stay proactive about your health.